Even though watermelon is a sweet fruit, it has a limited amount of sugar and carbohydrates. If you eat the fruit, not the juice from prepackaged bottles, it is unlikely to cause a blood sugar spike. Watermelon is a delicious and refreshing fruit that is packed with nutrients and beneficial plant compounds. Here are some of the top health benefits of watermelon. Watermelon is about 92% water, making it a great way to stay hydrated, especially during hot weather. Even though it has a high glycemic index, it has very little carbohydrates. Watermelon is a low-calorie fruit that's a good source of vitamins A and C, as well as potassium and magnesium. It may improve heart health. Watermelon contains an amino acid called citrulline, which may help improve blood flow and lower blood pressure. Lycopene, another nutrient found in watermelon, has also been shown to benefit heart health. Watermelon contains antioxidants and other beneficial compounds that may help reduce inflammation in the body. Chronic inflammation is linked to many diseases, such as heart disease, cancer, and diabetes. Watermelon juice may help reduce muscle soreness after exercise. This is likely due to its citrulline content, which can help increase nitric oxide production in the body. Nitric oxide improves blood flow and may help reduce muscle fatigue and soreness. May aid skin health. The vitamins A and C in watermelon can help promote healthy skin. Vitamin C helps your body produce collagen, which keeps skin looking plump and youthful. Vitamin A helps repair skin cells and may help prevent dry, flaky skin. May help with digestion. Watermelon contains fiber, which is important for gut health. Fiber helps keep your digestive system moving smoothly and may help prevent constipation. Watermelon leaf, a potential ally in diabetes management. Watermelon, a juicy and refreshing summer staple, is not just a delicious treat. Research suggests that various parts of the watermelon plant might hold hidden benefits for our health. One such area of exploration focuses on the leaves of the watermelon plant, Citrullus lanatus, and their potential role in managing diabetes. This research article delves into a specific study that investigated the effects of watermelon leaf extract on obese rats with type 2 diabetes. We'll explore the design of the research, the findings, and what they might mean for the future of diabetes management. Setting the stage, understanding diabetes and its complications. Diabetes mellitus, commonly referred to as diabetes, is a chronic health condition that affects how your body regulates blood sugar, glucose, levels. There are two main types: heart disease and stroke. High blood sugar levels damage blood vessels throughout the body, increasing the risk of heart attack, stroke, and peripheral artery disease. Nerve damage, neuropathy. Chronically high blood sugar can damage nerves, leading to pain, numbness, tingling, and weakness, especially in the feet and legs. Kidney disease. Diabetes is a leading cause of kidney failure. High blood sugar levels can damage the tiny filters in the kidneys, leading to a buildup of waste products in the blood. Eye problems. Diabetes can increase the risk of diabetic retinopathy, a condition that damages the light-sensitive tissue at the back of the eye, retina, and can lead to vision loss. Foot problems. Nerve damage and poor circulation in the feet can increase the risk of infections, ulcers, and even amputation. Effectively managing blood sugar levels is crucial in preventing or delaying these complications. Traditional treatment options for diabetes include lifestyle modifications, diet and exercise, medications like insulin or oral diabetes medications, and regular monitoring of blood sugar levels. Exploring new avenues. Watermelon leaf extract and its potential. Researchers are constantly on the lookout for new approaches and natural remedies that could complement existing diabetes management strategies. One potential area of exploration is the use of plant-based extracts. Watermelon leaves, traditionally used in some cultures for various health purposes, have piqued the interest of researchers for their potential anti-diabetic properties. This particular study aimed to investigate the effects of watermelon leaf extract on a group of rats with type 2 diabetes. The research design. Unpacking the experiment. The study involved a group of 40 male Sprague-Dawley rats. To induce type 2 diabetes, the researchers combined two methods. High-fat diet. The rats were fed a diet high in fat, mimicking a lifestyle factor linked to the development of type 2 diabetes in humans. Streptozotocin, STZ. Administration. STZ is a chemical that can damage insulin-producing cells in the pancreas, further mimicking the effects of type 2 diabetes. After inducing diabetes in the rats, the researchers divided them into 5 groups. Control group. These rats received a regular diet without any interventions. HFD, STZ group. This group continued on the high-fat diet and received a low dose of saline solution, a salt and water mixture, to mimic the injection process without any active treatment. HFD, STZ plus metformin group. This group received the high-fat diet and STZ, along with a standard dose of metformin, a common medication used for type 2 diabetes management. Metformin helps the body use insulin more effectively and lowers blood sugar production by the liver. HFD, STZ plus low-dose watermelon leaf extract, LD. This group received the high-fat diet and STZ, along with a low dose of watermelon leaf extract. HFD, STZ plus high-dose watermelon leaf extract, HD. This group received the high-fat diet and STZ, along with a high dose of watermelon leaf extract. The researchers monitored the rats for 6 weeks. During this period, they measured various parameters to assess the effects of the interventions. Body weight. Changes in body weight can indicate the overall metabolic health of the rats. Fasting blood sugar. This measures the blood sugar level after the rats hadn't eaten for a period of time. Chronically, after the 6-week intervention period, the researchers observed some interesting findings. Body weight. The rats in the control group and the HFD, STZ group, which did not receive any treatment for diabetes, gained weight throughout the study. However, the groups receiving metformin or watermelon leaf extract, both low and high doses, showed a reduction in weight gain compared to the control and HFD, STZ groups. Fasting blood sugar. Importantly, all the groups that received interventions, metformin and both doses of watermelon leaf extract, displayed significantly lower fasting blood sugar levels compared to the control and HFD, STZ groups. Notably, the high dose of watermelon leaf extract appeared to be as effective as metformin in reducing blood sugar levels in these diabetic rats. Other parameters. The researchers also analyzed various other parameters, including serum insulin levels, lipid profiles, fats in the blood, and markers of oxidative stress and cell damage. The groups receiving metformin and watermelon leaf extract, both doses, generally showed improvements in these parameters compared to the control and HFD, STZ groups. Additionally, the high dose of watermelon leaf extract appeared to be particularly effective in protecting the kidneys and liver from damage associated with diabetes. What do these findings mean? A cautious look at the future. The findings of this study suggest that watermelon leaf extract might hold promise as a potential complementary therapy for managing type 2 diabetes. The extract appeared to be effective in lowering blood sugar levels, reducing weight gain, and improving other health markers in diabetic rats. Interestingly, the high dose of watermelon leaf extract seemed to be as effective as metformin in some aspects. However, it's crucial to emphasize some key points. This was a study in rats, not humans. While the results are encouraging, further research in human trials is necessary to confirm the effectiveness and safety of watermelon leaf extract in people with diabetes. The study design had limitations. The specific components in the watermelon leaf extract responsible for the observed effects remain unknown. Additionally, the optimal dosage and long-term safety profile of the extract in humans need further investigation. Watermelon leaf extract should not be considered a replacement for traditional diabetes treatment. Consulting with a healthcare professional before using any complementary therapy, including watermelon leaf extract, is essential. Conclusion: a glimpse into the future of diabetes management. The potential of watermelon leaf extract as a complementary therapy for diabetes management is an exciting avenue for further exploration. This study provides a valuable starting point for future research, paving the way for a more comprehensive understanding of the extract's effects and its potential role in diabetes management strategies. However, it's important to maintain a cautious and evidence-based approach. Only through rigorous scientific studies can we determine the true potential of this natural remedy and ensure its safe and effective use for people with diabetes. Watermelon has been used to treat various ailments, such as cardiovascular diseases, aging-related ailments, obesity, diabetes, ulcers, and various types of cancers. The medicinal properties of watermelon are attributed by the presence of important phytochemicals with pharmaceutical values such as lycopene, citrulline, and other polyphenolic compounds. Watermelon acts as a vital source of L-citrulline, a neutral alpha amino acid that is the precursor of L-arginine, an essential amino acid necessary for protein synthesis. Supplementation of L-citrulline and lycopene displayed numerous health benefits.